The Federal Ministry of Health says it has recorded improved access to voluntary family planning and other sexual and reproductive health service through its Women Integrated Service for Health project. The Director of Program Operations of International Non-Governmental Organization Stopes Nigeria, Emmanuel Aja, stated this at a stakeholders meeting in Abuja for Women Integrated Service for Health Extension project. Our correspondent, Edeke Emmanuel, reports.
The meeting was an opportunity for officials of the Federal Ministry of Health and Mary Stopes International Organization to discuss the successes achieved in boosting access to family planning services. It also provided participants a platform to make recommendations on ways of improving better maternal care for women in 6 select states of Nigeria. The WISH project, which was implemented to support Nigeria's progress towards universal sexual and reproductive health rights of women and girls, was first launched in 13 states, after which the success of the first phase led to the implementation of phase 2 in the 6 states of Bauchi, Sokoto, Adamawa, Borno, Kano, and Jigawa states. Participants at the event said the discussions are timely and hope that the authorities will implement the recommendations made.
The project strengthens individual knowledge and choice and builds community support for sexual and reproductive health services. It improved access to and expanded choice of voluntary family planning and other sexual and reproductive health services. The project also promoted a supportive legal, financial, and policy framework and increased women's choice and access to sexual and reproductive health and rights services through evidence-based innovations and best practices. At inception, the project was to achieve the following milestones. We're just looking at 3 million CYPs, that's couple year protection. We're looking at reaching 670,000 additional users, and we are looking at averting 1.2 million unwanted pregnancies. We equally wanted to prevent 9,700 maternal deaths and achieve 3.4 million disability adjusted life years. Surpassing all the milestones, the WISH project delivered 6.1 million couple year protection, which was about double what the target was, and this reached out to 1.4 million additional users, which was almost 220% higher than was projected, and averted 1.2 million unsafe abortions. The project also averted 2.2 million unintended pregnancies and prevented 16,000 maternal deaths against the 9,700 that was set. The partners cannot do this alone. We count on the support of the Federal Ministry of Health and the commitment of the states' ministries of health of Sokoto, Bauchi, Adamawa, Borno, Kano, and Jigawa states to provide quality health care to the good people of these states. I have no doubt that governments of the project states will lead this initiative in bringing about a reshift in quality assurance and sustainability of health interventions in the state. The consulting partners will continue to provide technical service to ensure this is successfully entrenched.
The Director of Family Health Services in the Federal Ministry of Health, Dr. Salma Ibrahim Anas, says that women, adolescents, and children in these states are living healthier because of the project. Anas says more effective reproductive health services has ensured women practice better spacing for their children, leading to healthier lives for babies and nursing mothers.
So the impact we are beginning to see is the impact on the health and well-being of women, adolescents, and children, because it improves access to uptake of sexual and reproductive health services, including the family planning services. When a woman is able to space her children, she nurtures the child better, and it greatly improves child survival. It reduces illnesses. It reduces unnecessary burden on our health facilities. And then you find out that most of the burden that we have, especially at the primary healthcare and secondary level, are greatly reduced, and in a way also reduces stress and burden on the tertiary institutions. So especially now with the economic dwindling economy, this is the time that we need to put in all our efforts to ensure that a project like the WISH project is scaled up nationwide. The governments, especially at the subnational level, sustain the projects and integrate it within all their health sector response, especially within the work that they do around family issues, which is the reproductive, maternal, newborn, adolescent, and child health, including nutrition activities at the subnational level.
The chairman of the management committee of the Association of the Advancement of Family Planning, Dr. Ejike Oji, who was in attendance, urged Nigerians to space their children and raise only those they have the financial means to cater for. Oji blames the practice of giving birth to many children on poor healthcare services as women fear losing their children. Other participants at the event also tasked the federal and state governments in the country to provide better health care services for their women.
Let people be able to plan their families and have babies and children they can take care of. Following that, we will start appropriate, accessible, and comprehensive healthcare delivery to our women. Because one of the key drivers of also population growth is that if a woman feels that she will lose her children, then she wants to have 10. So if she loses 8, at least she will have 2. Then when things improve a little, all those 10 might survive. You see how population crisis goes on. But if you have a very good healthcare system that guarantees proper healthcare, so the under 5 mortality will come down. So the woman will know if I have 2, those 2 will survive. So that will now start moderating her appetite for more children. The third one is to make sure that the children we already have, we give them accessible, appropriate, and relevant education. That way, they will be employable or they can employ themselves. And before you know it, they will be able to start making money, and then the GDP of the country will improve. But added to that, to make sure that happens, the government must introduce the ease of doing business. And then finally, Nigeria must be a country of equity, transparency, honesty. We must be fair to each other. Civility.
The WISH extension is here to support federal and state governments to really ensure that Nigeria's women and families are able to access reproductive health services where they need it, when they need it, for the betterment of their health and the health of their families. So I'd encourage those women and families to access this as much as possible.
Edeke Emmanuel, reporting for Development Nigeria Television.